Hello and welcome to Visionary Voices, powered by Optimum Healthcare IT, our conversational thought leadership podcast where digital and technology healthcare leaders come to talk about their latest transformations, their latest innovations, and successes at their organizations. I'm your host, Larry Kaiser, Chief Marketing Officer at Optimum Healthcare IT, and I'm excited to bring a season of new leaders, new ideas, and new conversations with people shaping the future of our industry to you, our listeners. And with that, let's dive in. Hello and welcome to this episode of Visionary Voices. Today's guest is Alex Krinsky. He's the Senior Director of Healthcare Business Development at CLEAR. Alex is a former Epic, has a great deal of experience in the healthcare space, and is right now working with health systems to rethink something that's often overlooked but incredibly critical, which is identity. So many of you probably know CLEAR from the airport as that security identity company that has a special lane that you go through. But what you don't know is that CLEAR may have, what you may not know is that CLEAR has expanded into healthcare, into financial services, and other markets. But today we're really going to focus on and talk about how CLEAR is bringing its technology into healthcare and learn how it is revolutionizing identity verification. Alex, thanks for joining the podcast today.
Thanks so much for having me. Excited to be here.
It'll be a lively conversation. So our first segment of our podcast we like to call Bandwidth Banter, which is just our little way of having little icebreakers and helping the people who listen to our podcast understand who our guests are, know a little bit more about them, add a little bit more human element to it. So as I mentioned in your intro, you are our former Epic. So that's a badge that gets carried around healthcare quite a bit. So I'd kind of like to kind of quick little overview of kind of what your experience was working with Epic and how that experience has shaped your career in healthcare moving forward.
Yeah, absolutely. Well, even before Epic, I would first mention that my dad is an infectious disease physician, practiced in Sarasota, Florida for many years. And so I think as I first got to the Epic campus, I was excited to work on a product and technology that would directly impact providers like my dad and the patients that he saw. Um, Overall, I, really enjoyed the experience. I loved how closely I was able to work with really large, complex health systems that were, really focused on providing the best patient care they could. I spent a lot of time with Hartford Healthcare, which is an incredible organization in Connecticut. Um, and as I moved on to the next phase of my career, I think, I took away, really a relentless focus on how the technology should really serve the workflows in the best interest of the provider and the patient. And also just, the project management expertise. I know, it's been talked about more recently since they did the acquired podcast about Epic, what implementation folks do at Epic. And I think the skills I took away in terms of, pure organization and communication have proven valuable, at Flatiron Health and also, here at CLEAR.
Awesome. Yeah, that's a badge that gets carried around, former Epic. I can't begin to tell you how many profiles I see on LinkedIn with people that have that, and it really, I think it adds a credence to experience in healthcare if you spend some time working for them, being they are the industry leader in the EHR space. So, all right, so let's shift something a little more personal. Um, I'm a music buff myself. I'd love to know what your last concert that you went to was.
Yeah, I was looking at your Pearl Jam poster there behind you. So I love music, love live music. So does my wife. Every year we go to Newport Folk Festival. I think uh, something fun that we have kind of revisited recently is we love punk rock. We grew up with punk rock. And so last year we went to the Warped Tour, which came back after a multi-year hiatus. Had the best time seeing old bands we used to listen to and some new ones. And so recently, one of the bands that we saw for the first time at Warped Tour from Kalamazoo, Michigan, was playing in Brooklyn. And so we went to the concert and it was incredible, high energy. We had the best time. So Saturdays at your place, up and coming emo pop punk band. Recommend everybody check them out.
I'm just asking, did they play at Rough Trade?
They did not play at Rough Trade. They played in Bushwick, but
Okay.
I love that you brought up Rough Trade. Amazing, amazing venue in Williamsburg.
Yeah, we saw several years before my wife and I moved, we saw the church play there, and it was kind of cool to be able to walk in and shop for some records and then go and, drop down my cup of water on the stage, and I'm right in front of the guitarist the entire time. I almost got kicked in the face by the lead singer because he's a kicker. But it's a great little venue down there.
Yeah, I mean, one of my favorite things about living in New York City is just all the music and the different venues. It's there's always something to see every weekend.
Yeah, I miss the access not living in New York anymore to all the concert venues and so forth. So, but cool. Like, hey, punk rock is good. It kind of falls into my world. I'm a big grunge guy, and those guys are into their mid 60s now, so it's more like dad rock, I guess now. But those punkers probably don't move around as much as they used to.
That's been a big realization for me as I've continued going to concerts is that I'm now in the older category of people seeing bands that were popular 20 years ago. We went to
Yep.
Incubus at Madison Square Garden last year, and you know, I think I was maybe the youngest person there. And so I've definitely entered that like next phase of my life.
Yeah, it's hard sometimes to realize that you're getting older. I keep saying that getting older stinks. So,
But the
anyway, well, good
music is
stuff.
always good. So,
Music is always good, right? We love live music, and we went to a show a couple weeks ago, Gaelic Storm, which is like Irish drinking music, a lot of fun. And I'm taking my wife to see Youngblood for her birthday, um, and we're going to go see Alter Bridge as well. So yeah, we try to. It's a little bit tougher now with a 6-year-old, but we try to go to as many as we can. Um, because live music is fun.
well, since you mentioned them, I have to also shout out Fontaines DC, an incredible Irish band. If you haven't listened
Yeah,
to them, you got to check them
I've
out.
heard them. Yeah, yeah, they're
Yeah.
good. They're good. My dad got me into like the Celtic rock stuff, and what actually coincided very well is when we went to see Gaelic Storm. My daughter in kindergarten, they were learning about Celtic and Irish history and so forth, and so we played her some of the Irish bands, like Flogging Molly and Gaelic Storm and,
Yep.
and El Fontaine. And she was dancing around. And I believe she specifically said, "My feet won't stop moving to this music."
I love
So
that.
me too, me too. Anyway, so enough about music and punk rock and Irish music here. So let's kind of get into the meat of the conversation here. So, like I said earlier, I would say that anybody who's probably listening to our podcast is familiar with Clear in the airport. But what I'd like to talk about is really the company's expansion into healthcare and why that the decision was made to get into the industry.
Yeah, absolutely. So I think what's really interesting about Clear and getting to know this organization is that the mission of Clear has always been bigger than the airport. It's about giving consumers the ability to, leverage their identity in a really seamless way, whether they're traveling through an airport, receiving healthcare, or banking with a financial institution. And so we started in the airport. We've been working in close partnership with the TSA for 16 years now. We're available in over 60 airport locations across the country. Um, and as we've looked to expand beyond the airport, healthcare is a space where there's a lot of friction. There's a lot of challenges when it comes to security. And it's really paramount that you have a combination of a simple user experience while also delivering, best in class, high assurance identity. And so it's been a really organic transition to move into healthcare and begin to work, with a number of different partners, health systems, digital health companies, and plans. And so as we talk about the different ways we work with healthcare organizations and support patients or providers, it's under the umbrella of Clear One. So, Clear One is a secure identity platform that allows a user to verify their identity from a mobile phone in a matter of seconds. And, with a simple selfie, we're able to pull in different types of proofing checks and signals to ensure that Alex is really Alex in that moment. And ultimately, what we are trying to do, as patients move through a healthcare journey or as providers treat patients, there's an emotional burden, there's an administrative burden, and we're trying to make it simple and secure. It really comes down to that. And so we've been really fortunate to work with a lot of great partners across the healthcare ecosystem as we've moved into the space.
I think my first interaction with Clear in healthcare was the first year that HIMSS came back from COVID. They used the CLEAR platform to validate COVID vaccinations.
Yes.
Was that the jumping off point getting into healthcare, or were you in healthcare before that?
We had started to get into healthcare just before that, with again the simple premise that you are you and you should be able to reuse your identity with a selfie across those experiences. COVID, uh, as it did with many situations, threw a curveball. And what we actually found was the ability to um, match an individual's identity to their COVID vaccination and make it really easy to reuse and demonstrate to something like a HIMSS conference. It removed a lot of friction while also helped individuals at that conference feel more safe and secure. So it was also really interesting to see the market respond to that. And, consumers trusted CLEAR as a source, with that data. And so as we came out of COVID, our ability to really demonstrate, how we build trust with consumers has been really important to our customers in terms of how they interact with a patient, for example, that's engaging with them digitally. And so that Health Pass product existed for several years during COVID, and then now, as we're in kind of the post-COVID era, Clear One is that identity platform that our partners are using across the market.
Very cool, very cool. Last year, obviously, Optimum and Clear have a partnership, and we used your platform in a certain way. But you guys have also built a relationship with Epic, as well as signing up for that CMS Health Tech Ecosystem initiative. Um, can you dive into a little bit of what you're doing with Epic? What kind of challenges are being addressed, and how Clear is being used or being leveraged to solve some stuff? Are you like directly integrated with Epic?
Yeah, that's exactly right. So at a high level, Clear works in collaboration with Epic through its Toolbox program, which is a modern iteration of the showroom. And I think what's been interesting, for me coming from Epic is that both Clear and Epic are organizations that really listen to their customers. And so as we began to work with more health systems across the country, we jointly identified areas where there was a lot of friction for patients or providers and some security risk as well. And so, over the past several years, we've developed a number of integrations where a patient, for example, can leverage Clear to create their MyChart account or reset their password or check into a clinic via Epic's Welcome product. And at the same time, we're collaborating on products and use cases for providers as well. So in the February 2026 version of Epic, there will be Clear for Epic Care Link, which we're really excited about. And so I think at a really high level, the showroom program and product has made it really simple for our mutual customers to turn Clear on, and make sure they have the right level of identity in those moments that matter to them.
So if someone does use the Clear platform, like myself, for example, and the healthcare organization I go to uses Epic, then I can use that to create certain things. So it's not necessarily that the hospital needs to have their EHR within the hospital is set up to work with it, but it's still the individual user who is using the platform.
That's exactly right. You bring up a great point. So Clear is a networked or reusable identity. And so if you are someone that uses Clear in the airport, or if you are someone that has verified with Clear on LinkedIn, you can then reuse that identity with a simple snap of a selfie across different experiences. And
Gotcha.
so,
Okay.
you know, I think what's really exciting about this is, for me as an airport member, when I go to, my provider's MyChart, if I need to reset my password, it's as easy as a selfie. And the proper consents, of course, consenting to share my data with that provider, but it's a really simple process. And I can reuse that identity across all of Clear's ecosystem partners.
Very cool. Yeah, I haven't used it from a healthcare perspective yet, but I've used it in the airport most recently over the holidays, and I was I had to double check. I had to actually call Clear customer support because my daughter is 6, and she was able to go through with me. And there are some airports I go to where it's not necessary to use
Sure.
Clear. In this case, we're flying out of LaGuardia, 2 days after Christmas, so it was going to be pretty busy,
Yeah.
and it was boom, boom, boom,
Good. I'm glad
and
to
it
hear that.
was.
We recently in the airport rolled out e-gates, which allow a traveler to take a selfie to verify and then simply walk through the gate. Um, it's been tremendous. We've gotten a lot of really positive feedback, and just for me personally, as a frequent traveler, I absolutely love it. It makes it really easy to get through security.
Yeah, so I'm looking forward to that point when I can use it in a healthcare environment, because I have it now. And I'm like, ooh, there's so many cool things that's happening with you guys in healthcare right now. Like, if it's going to save me clicks on a keyboard to check in or do other stuff and just boom, take a picture, there you go. That just makes life easier, because we all there's so much time in a day, and you relish when you can save seconds and minutes because you can put that towards you know, rest and relaxation, recharging, or something else, or time with the family. So I'm looking forward to the opportunity to do it. I haven't had one come yet, but I'm looking forward to it for the most part, because most of the hospitals that I go to in this area are all Epic. So, all right. So the
Well,
other piece
hopefully
is
you'll be
the
able to use it soon.
yeah. I mean, I don't want to have to go to the hospital, right? But it'd be cool to check it out. So the other piece of this, of course, is you guys joined the CMS Health Tech Initiative. Can you tell us a little bit about that and what's the goal of that initiative?
Absolutely. So the CMS Health Tech Ecosystem, which was announced last summer in July, is a really innovative and forward-thinking program with a couple of major goals. I think first and foremost, the administration wants to empower patients, empower individuals to access their own data and promote modern technologies applied to that data. I think some really kind of exciting examples we've seen in the market over the past several weeks is OpenAI Health and Claude Health through Anthropic. It's early days, but really exciting to see what can happen when patients can bring in their data and ask AI certain types of questions. Another part of the initiative is focused on a national provider directory to really refine how we manage provider data across the country. As a part of those initiatives, modern identity is considered very foundational to enabling organizations to really meet the goals. I think to keep it really simple, in order for, me, Alex, to pull in my data and do really interesting things with it or apply AI to it, we first need to make sure that I'm really Alex. And so, as these programs and as these products are coming to life, CLEAR provides IAL2 identity, which is a NIST certification that essentially means we build a multi-layered identity across biometrics and government documents and database corroboration and signals to really make sure with very high assurance that I am who I say I am. And so that allows me to then pull in data from various CMS aligned networks with the proper consents. And so what's really important as well is, exchanging data is sensitive, right? You need to really make sure the right data is getting to the right place. And I think CLEAR is really excited to help build trust, accountability, and transparency into the process. That's going to be paramount. As more data is exchanged, we want to make sure that we are, helping contribute to the infrastructure to make sure this is done safely, while also allowing patients to interact with their healthcare data like they do, even their music data or their shopping data. So we're really excited about what's ahead.
Yeah, I mean, so that goes really and segues well into my next question, is that 3 to 5 years from now, you know, I, identity is going to be playing, I think, a bigger role than it does now. What do you kind of see that coming into? Since I would say right now in the healthcare space, it's still in its infancy, but you know, healthcare loves data.
Yeah. I mean, we believe I think CMS and other, entities believe that identity is going to be really foundational to how we innovate in healthcare over the next, several years, 3 to 5 years. Um, Based on, how our partners are leveraging identity and really leaning into, the TEFCA individual access services and the CMS Health Tech ecosystem, we're really excited about what's ahead. We think there's a lot of opportunity to make it easier for patients to aggregate their data. I think just to start with the most basic example, I live in New York City. I go to 4 different providers. I've worked in healthcare my entire career. And even for me, it's really, really challenging to request records and pull in data from different organizations when I need
Mhm.
it. It's a problem that the community, the market has been trying to solve for a long time. And I think we're at a point now where there's regulation and there's incentive to make it happen. But identity is foundational because there are a lot of different moments where you need to make sure you have the right person and you need verified, accurate data to match across different data sets. And so I think as we look ahead, uh, we're going to see more data sharing, but I think what CLEAR is, working alongside our partners to do is also make sure everyone is aware of how to do it right, how to make
Mhm.
sure it's safe, secure, how to make sure that patients get the benefit, but health systems also feel comfortable in what's being asked of them. It's going to take, the right incentives and the right protections across the different stakeholders required to share that data. And I think we're getting there. And I think CLEAR's role and identity's role more broadly is to make sure that security and accountability are really tangible and paramount as it
Yeah,
continues to evolve.
I agree with that one. So do you do you feel that health systems in a way are excuse me, maybe underestimating some specific risk areas today with identity in with that area? Or I mean, how did I'm sure, I mean, there's what, over 5,000 provider organizations in the United States. Um, what can CLEAR do to combat those risks that maybe a health system is underestimating when it comes to identity?
Our health system partners, it's I think what's interesting is it's not they're not underestimating it. They understand the risk, and I think what I enjoy is working with CISOs and CIOs across the country that are really focused on protecting their patients' data, but also protecting the experience of their patients and providers at the same time. What's challenging is that a lot of times the risk is not a sophisticated attacker or hacker. It's actually someone that uses a basic social engineering technique. For example, calling a call center, providing a different phone number for someone to do multi-factor authentication, and then getting access to their data.
Mm.
It's it's a really simple technique that CISOs, are very aware of. And where Clear helps is really making sure that they're able to verify the individual at the device in that moment. Historically, identity has relied on a couple of archaic tools. I think one example is, knowledge-based authentication, where, a credit bureau would say, Larry, what street did you live on 23 years ago, et cetera, et cetera. That actually sees really low conversion, and there's a lot of risk that that data is available online. Another common tactic that I think we all use now throughout the day is MFA, to the email and the phone. But the problem with MFA is, again, if you change the number, if you change the email, it's really easy for someone to take over that account. And so, what Clear does is it allows an organization to make sure they really know who is trying to access a system in that moment. And because of our multi-layered identity approach, we're able to provide, really valuable data and signals about that individual that's trying to access. And so, I'm consistently really impressed with our CISO partners and how forward thinking they are. And they have to be because unfortunately healthcare is a target. And so they really stay ahead of, how bad actors are trying to access that data.
Now, one word you used a multitude of times, and it's really the same thing with us, right? As an organization, Optimum Healthcare IT, is trust. Trust is a huge part of healthcare, whether you are a patient, trusting your provider, trusting your health system, whether you are a vendor trying to earn the trust of a client across the board, where you don't want to really be a vendor, you want to be a partner, but you have to build the trust to get there. So reflecting on trust, from Clear's perspective, do you feel that your focus should be building trust with the consumer to use the platform to identify in healthcare, or are you building the trust with the healthcare systems that this is the tool they need to use to earn the trust of their patients?
Can I say both?
Sure.
I'll say both. I mean, to us, going back to the airport, what we found from our success and our growth in the airport is that trust has boiled down to making a really challenging experience very simple and very secure. That's what we did for travelers. We really simplified the process and made it seamless for them. And so, as we think about the expansion into healthcare, working with our partners for any given health system, for their patients, what typically, I'll use my chart as an example. What historically required typing in demographic data and doing MFA or doing knowledge-based authentication gets replaced with a selfie. We've made it quicker, more secure. And for the health system partner, we've given them greater confidence and more visibility into what individuals are accessing their systems. Some of our partners, like Community Health Network, have shared some amazing results. They've seen 1.5x more conversion in my chart. They see over 90% pass rates with Clear compared to their legacy solution, which was around 50%. And so if you can just simplify and make it easier to do something while keeping it really secure, that's when consumers trust and want to keep using it. And so we try to bring that to all of the different, healthcare use cases and healthcare examples that we power for our partners today.
Awesome. Yeah, I kind of thought that was the angle you were going to go with that answer, because you're a B2C and a B2B business. And I've kind of said that about Optimum for years. Yes, we sell to health systems, we're B2B, but ultimately you're selling to an individual in that health system before you get to the health system. So we technically, on the most basic level, are a B2C as well. So it's our goal, of course, to build trust with our contacts and then the health system as a whole. In your case, you're building trust with the consumer to then use the product with your corporate clients.
Absolutely. And for me, on a personal note, coming to an organization like Clear, which hasn't historically been a healthcare company, it's been really refreshing to bring a D2C user experience into healthcare because we so desperately need it, as you know. And so I think right off the bat, a part of what, excites me about the work we're doing here is we're bringing a really delightful product that people love in their day-to-day life into healthcare, which is just generally a lot of friction. And so we're excited to continue expanding that presence.
That's awesome. Well, that concludes our discussion today. So I want to thank you, Alex, for joining the podcast today and really sharing some insight here. I will ask one final question: is if you have any additional insights or comments to make, whether it's to the consumer who may have not used Clear yet, or to the healthcare executives who'd be listening to our podcast today.
Well, Larry, first of all, thank you for having me on. Optimum Healthcare IT has been a tremendous partner to Clear, so we appreciate it. And I think, what I'll leave you with is, we're excited to keep growing in the space. We've driven a lot of strong outcomes in partnership with health systems and plans across the country. And to the point made earlier, identity is really foundational. There are more moments where we can reduce friction and make experiences safer. And so, you and I were talking before we started about attending some conferences, coming up, and we're always excited to meet more individuals, more organizations, and learn where we can help them. So always feel free to reach out, and we're excited to talk.
Awesome. Well, thanks, Alex. To our listeners, thanks for tuning in today to this episode of Visionary Voices, powered by Optimum Healthcare IT. And remember that the future of healthcare IT starts with your vision. We'll catch you next time on Visionary Voices.